How long did you have glaucoma?
I've had it for about 20 to 25 years. I lost track until I talked to my daughter the other day, and she said, "Dad, you had it when I was in high school."
And how did you know that you had glaucoma?
Well, through a regular eye checkup for glasses, you know, and then the doctor said, "Well, your pressure's a little high. I'm going to send you to a specialist," you know. And then determined I had glaucoma. So I've been on drops for about 20 years, 25 years, and it's, as Dr. Foster said, it scared me, because I figured if I had to take them twice a day, once in the morning, once at night, and if I forgot them, what's going to happen? You know, he explained one time what happens, and it scared the heck out of me. So I tried to make sure I took them, but you had to put the bottle in a certain way so I'd remember I already took them. And then you go on vacation, you get sidetracked, you forget them, and it bothers you that the fact that I missed one drop, what's happening to my eyes. So the surgery I've had has made me feel a lot better. I mean, I don't have to worry about that anymore, because I kept worrying about losing my vision.
And did you lose any of your peripheral vision at all?
No, not that I know of, because I think Dr. Foss would have told me, but
yeah,
I don't see nothing.
Yeah.
Dennis, since glaucoma has a hereditary component, did you have a family member with glaucoma?
Yeah, my brother and my dad were both diagnosed with it after I was. And my dad's passed away, so, you know, he was treated. But my brother never went in for checkups. And now he lost partially in his vision in his left eye. So if he would have had it taken care of, he'd have been all right, but he just kept, one of those guys that never go get any checkups or nothing, you know, and when he finally did, it was too late. He's lost part of his vision. So it's scary.
Yes,
because you don't, like Dr. Flood said, you don't know it's gone. It just starts going little, and
I
all
guess
of a sudden,
it's because it's so gradual, so it makes people don't realize they're supposed to be seeing big.
And the human brain is very smart, and it's very adaptable. And so when you have a progressive condition like cataract or glaucoma, you get used to declining vision over the years. And the brain is also smart. When you have a loss of peripheral vision in one eye, the brain actually fills in the visual information from the other eye, so you don't even really know it's missing unless you know, for some reason close one eye and realize, wait a second, you know, I'm not seeing in the periphery like I should be. So every once in a while I'll have a patient that catches it like that and comes in, but a lot of times the only way to catch it is with our testing that we do in the clinic.
Can you tell us from a patient perspective, what was your surgical experience like?
I don't remember much of it. So it was great. No, it was good. It was, the prep time was easy, you know, and they explained what they was going to do. And then once I was given the IV and put me out a little bit, everything was fine after that. And I thought it was very quick. I was surprised how fast it was. And I was up out of there and out and had a little scratchiness, but within a day that was gone, and didn't realize you had so much done, because Dr. Foster did so much in my eyes at one time that I was amazed that afterwards I didn't feel anything to speak of, you know. It was easy. And so I wasn't, he did one eye, then waited, what, 2 weeks, was it? And we did the other eye, and I wasn't nervous going back in the second time, because the first time was so good that the second time I was comfortable with it, you know. It turned out great. I mean, I feel so much relaxed now that I don't have to worry about taking those drops or missing them. I didn't mind taking them, but it was a pain, but to miss one scared me. Now that worry's gone, and it makes my life more easy, you know, easier. Not that stress there.
How nice. It's good for me to know as I get older.
Yeah.
I think that's very comforting.
Yeah, we have enough stress in our life without
Yes,
having to worry
we
about
do.
this. Yeah.
Yes, Dennis, I know you must be very glad that you did this surgery.
I certainly am, yes.
And how did you pick Dr. Foster?
Well, I was going to have it done up north, where my main doctor was, but then I've talked to so many people around here, and they said, well, a lot of people are my age, and so there's a lot of this surgery going on. And they mentioned Dr. Foster. He's a really nice personality, he's easygoing, and he kind of matches yours. So, you know, they said they've had a lot of good reports on him. So I said, sounds like my kind of guy.
And he was.
And he was. And I'm super satisfied with what he's done. and very comfortable with it. So I would recommend him to anybody.